Well, many people take GLP-1s to help them lose weight, but stopping those medications can have the opposite effect. Also, we know we're in the thick of allergy season, so there are a number of things that you can do to try to help yourself out. Plus, a new COVID variant has shown up here in Louisiana. To talk about all these health headlines, we have WWL Louisiana Chief Medical Correspondent Dr. Corey Hebert. Good morning.
Good morning. Yeah, this is a real wake-up call for our GLP-1 folks out there. Now, these are really important drugs. Everybody's using them. They're losing a lot of weight. But the issue is now what happens when you stop. So, journal published in Diabetes, Obesity, and Metabolism Journal in March 2026. This is the latest information. So what it showed is that once you lose a bunch of weight and then you have the cardio protection issue, decrease in your heart rate, all this good stuff, when you stop, then 90% of people will gain all that weight back, and the reversal of the cardiac benefits will also happen. Okay, now this is important because what we would see is that the early discontinuation of these medications, less than a year, also increase your risk of cardio toxic effects and heart failure. So this is the deal. You must change your lifestyle before you start these medications and continue that change of lifestyle after, or it is all going to be for nothing. As a matter of fact, what we are looking at is for how we're classifying this is not a stopping an endpoint in your treatment. It's called a high risk clinical transition when you stop the medication. Okay, so that means it's not just, oh, I'm finished losing weight. No, it is, I'm transitioning into something that I must do to maintain this weight, but also maintain the heart healthy effects. So please, folks, pay attention to this, because a lot of you out there, if you're not changing that lifestyle, you're going to bounce back, and all of the negative things that were before, they're going to be just as bad, if not worse.
Yeah, that's a tough one. Okay.
That is a tough one.
You got to think of it more of a transition. I think that's important there.
Yeah.
All right, so allergies, everyone's sneezing and coughing and showing up in the emergency room.
That's right. Please, clinics are full of patients with runny nose, cough, congestion. Okay, it's allergies. I want you to think about this. Think about me putting pepper in my hand and blowing it into your nose. Okay, that's what the pollen is. So when you start seeing that yellow stuff on cars and stuff like that, just remember that you need to start taking your medicine, but you need to rinse the pepper, which is the pollen, out of your nose. When you come inside, take a nasal saline spray, rinse your nose, that Navage treatment, a neti pot, whatever, because if you don't rinse out the pepper, then the symptoms will always be there, if you understand what I'm saying, right? So also, right now, if you're having really bad allergies, I want you to go to your phone, think about 1 month before right now, and then advance that a year. So let's just be clear. If it is April now, right, you need to go to the beginning of March, and I want you to put that for 2027 and say, start my medicine. Because these medicines are not really made to knock symptoms out a lot of times. They're made to maintain. So if you are already having the symptoms and then you start the medicine, it's not as easy to get them under control. So please, I need you to take the medicine before they start. All right, that's very important. And use every day when you come in, rinse out the pepper.
Okay, so allergies, that one, but then also people are looking at a new variant of COVID.
Yeah, I've been known around the world now as the COVID doctor, and I don't know if I like the way that sounds, but there is a new variant. It's called the cicada variant. It's the BA3.2, and it's in 25 states, including Louisiana. There's a change in the spike protein, 70 to 75 mutations. The big question is, does it make you sicker? No, it does not make you sicker. Does it kill people more? No, it does not. But we're back to the loss of smell and loss of taste, which is a pain. But also the old vaccine doesn't necessarily work very well. So if you haven't had a vaccine in the last 12 months, you need to be very careful if you are over 65, if you're a young child, or if you're immunocompromised. So I hate to say it, COVID's back, but not the way it was.
All right, we appreciate Dr. Hebert for looking at those headlines for us. If for these stories and other health headlines, visit our website, WWLTV.com, or download our mobile free app, and we'll be right back. Time is 6:51.